Let's now hear from Dr. Ed Walker, medical consultant to CO Awareness.
We think carbon monoxide is a very under-recognised and under-diagnosed problem in this country, and I say we think because hard data is very hard to come by. It's very strange, there's more legislation concerning the amount of carbon monoxide you can have in the street in this country than there is legislation concerning carbon monoxide in the home, which is very odd because no one ever died of carbon monoxide exposure walking around outside. But that's why the work of carbon monoxide awareness is so vital, to raise awareness of carbon monoxide both amongst the general public and also, more importantly I think, amongst their physicians. Many physicians are not aware of carbon monoxide as such a common cause of common symptoms. The symptoms of carbon monoxide can unfortunately mimic a lot of other conditions. The symptoms will include things like headache, nausea, general tiredness, and in children so-called gastrointestinal symptoms such as nausea, vomiting and even diarrhoea can be quite common. Unfortunately, when a hospital doctor or a family doctor is presented with more than one member of the same household with symptoms like this, they will nearly always tend to diagnose a virus or some kind of infection. And tragically, the advice that's often given to people like this is that they go home and keep warm. So in other words, they go home, turn on the gas fire and shut all the windows and expose themselves to even more carbon monoxide. And exactly this sort of scenario has in the past resulted in the deaths of entire families. The scenario I often use is to say that a fireman who's presented with more than one member of the same house with similar symptoms will nearly always automatically assume that they've been exposed to carbon monoxide, whereas a hospital doctor or a GP presented with this picture will nearly always assume that the family have been attacked by some kind of virus. There is a very simple blood test that can be done to measure the amount of carbon monoxide in the bloodstream. Either a blood test or now even just a finger probe which measures the amount of carbon monoxide in the blood. Unfortunately, this can give a false sense of reassurance because carbon monoxide doesn't hang around in the blood if you're not breathing carbon monoxide. It has a half-life of around 4 hours, so if you leave it overnight, since you got exposed to when you have your blood test done, there may be no detectable carbon monoxide left in your system. And this is why it's important to recognise that while this test can be very useful, it certainly has its limitations. And just having a low or normal carboxyhemoglobin reading from your GP or from your hospital doctor doesn't mean to say that your house is a safe place to be. Raising awareness amongst the general public will include making sure that people have their gas appliances serviced regularly. And when I say gas appliances, I should really say any flame-producing appliance. That includes anything that burns gas or oil or coal or coke or anything that produces a flame can be a potential source of carbon monoxide. These should be all serviced regularly, and you should also have a decent carbon monoxide alarm in your house. One preferably with a digital display and certainly one with an audible alarm. It's also worth bearing in mind that houses with adjoining walls can sometimes be affected by people in neighbouring houses. So just because you haven't, for instance, got any gas appliances in your house doesn't mean to say that your neighbour in a terraced house may not be poisoning you with their gas fire. Treatment for acute carbon monoxide exposure is quite simple. It just involves giving the patient an awful lot of oxygen as quickly as possible, and this displaces the carbon monoxide from the blood. Unfortunately, people who survive carbon monoxide exposure can have long-term debilitating and sometimes permanent problems which are difficult or, if not impossible, to treat. And this again makes avoidance of carbon monoxide more important than ever. And one of the biggest tragedies about carbon monoxide is that it is so simple to avoid. I always say that about 80% of the work when it comes to carbon monoxide exposure is thinking of the possibility in the first place. Once you've thought that you may be being poisoned, or once a doctor has thought that his patient may be being exposed to carbon monoxide, that's 8/10 of the work done, because from there it's just downhill. And it's only through thinking about the possibility of carbon monoxide exposure that we can prevent tragedies in the future and prevent a lot of long-term ill health in the community.